Okay, so I'll start over. So she is a woman who gave birth. She had triplets. She was at home and suffered a postpartum hemorrhage. She called the ambulance, and the ambulance drivers arrived, and they asked her what drugs she had taken, and but they did not ask her how much blood she had had, or even go into her bedroom to see how much blood was on her bed and the towels on the floor and the blood all the way to the bathroom. And they then asked her, could she walk to the ambulance? And she felt faint. And she said, no, she didn't think so. And she was told that yes, they thought she could walk. And as she tried to walk, she collapsed. And when she got to the ambulance, in the ambulance, they proceeded to talk about what they were going to have for breakfast, and stopping at Starbucks, and when they would get, so they weren't ever, their level of concern for her wasn't ever really raised at a level that it should have been, given how much how much bleeding she had. And we know that hemorrhage is a leading cause of preventable maternal deaths. So I highlighted a few key points about this case, and just wondering, I mean, maybe it's too obvious, and I have a few other cases too, a few other things I want to point out, but just if anyone would be willing to put in chat a few of your thoughts around what were some implicit biases that were showing up by the behaviors I described. I don't think they meant to be disrespectful, right? So can you type in the chat what would be some of the times? Yeah, how strong she was. Her complaints weren't. She was asked about drug use, not about how much bleeding, right? She wasn't believed that she could not walk, right? So there was this whole like not seeing her or hearing her. Yeah, and asking questions about the bleeding, or yeah, about being pregnant. Thank you. Um, yeah. So honestly, this when she told me her story, yeah, the implication that she wasn't in distress and was in an emergent situation. Yes. And when she told me her story, what she called it was these small moments of decisions is how people get lost, right? None of them intended for her to be treated disrespectfully. But they came into her space with the already thinking that she might have taken drugs without having met her. With like they made all these assumptions about her and her life. Yeah, Barbara, exactly. The prejudgment. Yeah. And they weren't yeah, they weren't listening to her. So I don't know if any of you have seen. Thank you, Dr. Campbell. Thank you for joining. I don't know if any of you have seen the CDC actually put out a campaign called Hear Her. And it's because as they review maternal deaths over and over, and I have to say, I read every maternal death in California when I was working there for a 3-year period. And often it was delay in recognizing the severity of the situation. And the Hear Her campaign was started because this is a national issue. And this is an issue that we all can have happen to us, where we don't fully hear the person that, or see the person in front of us, or take time to really listen to the person. Yeah, and thank you, Sarah. Yeah, the materials from Hear Her are amazing. We also have a testimonial from one of our Speak Up champions, somebody who took our course, a physician, and we posted it on our YouTube channel. And she described how after taking the course, she had a patient come in. This had come in multiple times, but had been dismissed. Her pain had been dismissed. She was a 16-year-old homeless person, and that colored how people were taking care of her. And so she took the course. She went back and said to the team, look, this person has been here multiple times. It had been chalked up to that the woman was just trying to get attention, or just like they were judging her in negative ways and hadn't done a full workup. And she did a full workup, and they found out that she had a twisted ovary, and her pain, and rather than assuming that her pain was real, they were dismissing her pain. And that there's story after story of that kind of dismissing of people's real concerns. Next slide. Or I should say data. This article, I think, is also shows some really important case study findings. And these are, again, it's qualitative research, which means that these were the themes that were identified through the research. And in this case, it was disrespect, as I just showed you an example of disrespect. The stressful interactions are real. People are under stress, like trauma-induced stress uh, um, can cause people to not be able to hear or be able to absorb the information that is being taught to them. They often are dismissed by not being given adequate or full information, inconsistent social support, and then just overall discrimination, racism, and disrespect do have an effect on mother's health. I'm going to give another case example. We have time, and I think it's an important example to help us. This was published in the New England Journal of Medicine. It's called Hidden in Plain Sight, Reconsidering the Use of Race Correction in Clinical Algorithms. So this is at a more system level or a structural level. And this is helping you open your eyes to be more aware of the different ways in which you might be inadvertently, implicitly treating people differently, thinking that you're doing it in a very objective way. And the New England Journal of Medicine published showed different examples of clinical algorithms that were, it shows like bad data coming in and then bad advice coming out of these algorithms. And I'll give one specific for maternity care, is the VBAC calculator. So vaginal birth after cesarean are statistically Black pregnant laboring patients have lower rates of VBACs. Well, that meant that because they have lower rates of VBACs, it's if you back that up, they have also lower rates of being offered a trial of labor. So it isn't a physiologic difference in their bodies that's leading to lower VBAC rates, but the scientist who created the VBAC calculator took the data. It was real that yes, Black women had lower numbers of VBACs, and put that into the calculator, so that then when people were advising women on their chances for a successful VBAC, race was used to adjust as an adjustment in the calculator. So that then a person of color a Black woman in particular, would be told they had a lower chance of a VBAC, which then perpetuates this negative cycle. And it's an example that's in front of us on a lot of different issues, like prenatal testing results have also been based on, so you have to be really cautious of the data, like what's feeding these algorithms. And be really clear that there is no inherent genetic or physiologic reason why someone would have different outcomes. And so that behooves us to look deeper at the issues. So, so I don't know if you have any questions about any of the cases that or that those algorithms. If you've